Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome back, you've been on the program many times, Dr. James Cockey. You are the Deputy Health Officer at the Wicomico County Health Department.
Yes.
And you actually contacted me a few weeks back saying, can we talk about this very important topic of syphilis and the resurgence of syphilis? And it's happening in this county, statewide, and nationally. And I'll let you take it from here.
We have had, for the last 3 years in Wicomico County, a sexually transmitted infection task force that we started up in 2012, almost 4 years now, because we had very high rates of chlamydia and gonorrhea infections. And those are fairly common infections that a lot of mostly young sexually active people, both heterosexual and homosexual, transmit. And they're diseases that perhaps many people don't take very seriously because they may be uncomfortable and have discharge and have some degree of painful urination, but they go to the hospital, and they go to the emergency room or to the health department, and they get a shot and a couple of pills and it goes away. And so they're not, they don't elicit the fear that things like HIV do, and people, young people don't seem terribly worried about them. But our STI task force has had, with a lot of community collaboration, had pretty good success in reducing the rates of chlamydia and gonorrhea. And we've had 3 consecutive year-by-year decreases in those two at a time when nationally and statewide those rates are going up. But what made us want to reopen the attention on sexually transmitted diseases was syphilis. And syphilis is an ancient disease. It's been known for many hundreds of years. It's a disease that, unlike gonorrhea and chlamydia, can be fatal. It's a disease that in years past was a fairly common cause of dementia. People who had syphilis for 10, 20, 30 years would have ongoing damage to their brain, and a fair number of people who were demented or institutionalized had neurosyphilis. And it can also cause major problems in bone and in the aortic valve, which can also lead to death. Syphilis has been readily treatable for over 60 years, and the health system has good treatments with injectable penicillin to cure syphilis. The key to that is people being diagnosed and being brought into the healthcare system, being tested, and being treated. And in addition to the benefit for them, it can be a benefit for future sexual partners in not transmitting it. Syphilis rates have always been much lower than gonorrhea and chlamydia rates, but starting in 2014 and continuing in 2015, there's been major rises in the rates of syphilis, and this has been true all over the nation. And one of the things that was first noticed and was in the news was cases of ocular syphilis, syphilis in the eye. First noticed in California in 2014, and then there was more aggressive record keeping, and it was noticed all over the country, including in Maryland. These cases of ocular syphilis were much more common in men who have sex with men, and also men who have HIV. But in addition to the ocular syphilis, syphilis rates nationally have gone up. And what got our attention last month was the CDC published the final analysis of the 2014 sexually transmitted infection rates, including syphilis. And gonorrhea and chlamydia had gone up significantly. Syphilis had gone up a whopping 15%. And of that 15%, most of those were males, not females. The number of females with syphilis is relatively small compared to the males. And of the males, it's overwhelmingly men who have sex with men. So both locally with our STI task force and statewide through the Department of Health and Mental Hygiene, as well as nationally through the CDC, there's attempts to increase the public's awareness of this and to try to come up with plans and programs and interventions that can reduce the incidence of syphilis.
Well, before we get into the why we're having this resurgence, you touched on it a tad. Maybe just give us an overview of exactly what it is, how it's transmitted, and the signs and symptoms. You said it's very treatable.
It has been very treatable since penicillin was developed for this purpose in the 1940s. We, in my career, since the late 70s, I think we've done a very good job in detecting syphilis, and whenever we have a case of syphilis, we do aggressive contact testing, and we have specialists, we call disease intervention specialists, who will talk to someone diagnosed with syphilis and get all the information they can about sexual contacts and track those people down and get them tested. And we've done a pretty good job. It's just the last 2 years things seem to be shifting. Syphilis was not known in the European world until around 1500. And there was a theory that the sailors that came over with Columbus perhaps contracted it as a disease that was native to the Americas. At any rate, from the 1500s on, it spread rapidly through Europe. At that time, created large ulcerated lesions all over the body, and it was known as the Great Pox, in contrast to smallpox, which had smaller lesions all over the body. There was no treatment for it. It was known to be sexually transmitted. And in a small percentage of cases, it would lead to chronic illness. The rashes and the ulcerations would go away, but it can lead to chronic brain damage. It can lead to the heart disease in the aorta that can lead to sudden death and to bone damage. And one of the most horrific things is pregnant women who are infected with syphilis can transmit it to their newborns, and it can cause major birth defects in the newborn babies, which while the baby can be treated, the birth defects do not go away. Nowadays, the most common way of finding syphilis is through blood tests, and we have rules and algorithms for determining whether a case is a new case or an old case. Occasionally, we have people coming in with the classic ulcerated sores or with the diffuse rash with a history of sexual exposure.
You're saying all over, not just in the genital area.
Well, the rash all over in secondary syphilis is not the ulceration rash that was occurring in the 16th century. The actual ulcerations tend to be locally in the genital area or in the mouth if there's oral sex. But there are other diffuse rashes which are part of the manifestation of secondary syphilis.
So that's the typical first symptoms of why someone may come to a doctor. I mean, tell us what would bring someone to...
Most commonly, we pick it up through blood test screening. It is relatively infrequently that someone will have a persistent ulceration in the genital area that they come in for evaluation and is diagnosed. Most commonly is through blood tests and through doing the blood tests on contacts of cases.
Well, that makes it more difficult then, doesn't it?
Yes. And people with gonorrhea and chlamydia have lots of symptoms. They have lots of discharge. It's painful. They seek out medical help. That's relatively less common with syphilis, which is often asymptomatic, although chlamydia and gonorrhea can also be asymptomatic.
And then just to reiterate how exactly it's transmitted, because it's an organism, so... Right.
It's a bacteria, and it is transmitted sexually. There was a time, this goes back into the history of medicine, back in the 16th and 17th century, where when people had the diffuse ulcerations and if you were of low income, you might live in very crowded situations, and it could be at that time transmitted person to person without sex. But nowadays that is unheard of, and it's nearly 100% sexually transmitted or transmitted from a pregnant woman to her fetus.
So oral sex, anal sex, vaginal sex, all of that, it's transmitted. And what populations seem to be most at risk? You kind of mentioned already, these days it's more so in men. What age group, ethnic group?
The population that over the last 2 years has had the highest incidence of syphilis is men who have sex with men. And that also correlates with the population that has the highest incidence of HIV. And the syphilis cases that have become so prominent over the whole country over the last 2 years, half of them are men who are infected with HIV. So they often go together. This tends to be something in young men in their 20s. In Wycomico, we've had a higher proportion in 35 to 45, but in general, it's young men and overwhelmingly young men who have sex with men. Nationally, there is a concern that young men of color, young black men who have sex with men, are a population where HIV has been particularly high, and it's also just there are disproportionately high rates of syphilis in that population.
And of course, I think we want to clarify that men having sex with men doesn't necessarily mean that you're gay.
Yes, and that's one of the things that the CDC is strongly emphasizing in this current campaign to try to deal with the rise in syphilis, that there are many men who identify as heterosexual, who are married, but who also at times will have sex with another man. And the CDC is trying to emphasize that awareness in the general population as well as in physicians. And there are cultural subpopulations in the United States where it is very difficult for a man to acknowledge being gay. And so doctors are being encouraged to be specific in doing sexual interviews with patients with questions like, how many people have you had sex with in the last couple of months? What particular practices? Were your sexual partners all men, all women, or both? And trying to get in the habit of asking those questions with every patient and not making assumptions based on a person's appearance as to whether they're heterosexual or homosexual or what.
So this leads us to, I know you want to discuss some issues about why exactly there's been such a resurgence of syphilis in general. I'll let you take that one.
And part of that, the general thinking and the CDC's thinking, part of it is the stigmatization of men who have sex with men that makes it more difficult to find medical help that they feel comfortable with and they're willing to open up with. Part of it is that the men who have sex with men population, to start with, has a higher incidence of sexually transmitted diseases, including syphilis and HIV, so that it's they're more likely to transmit them. Another new wrinkle the last couple of years is social apps, and there are social apps available on smartphones for anybody, for a man seeking a woman seeking a man seeking a man, whatever.
So this is beyond Facebook.
This is way
special
beyond Facebook. These are on the smartphones. You can download the apps to your smartphone, and the smartphones know where you are. You can allow the GPS to identify where you are, and you can say you're searching. You're a 31-year-old male searching for a male sexual partner within 5 miles. And these apps make it very easy to make those contacts. In the past, casual sexual contacts have always occurred, both heterosexual and homosexual, but they weren't that simple. People had to make more of an effort to go to places to meet other people, get to know them a little bit before they might move on to that next step. The social apps have expedited casual sexual contact, and they have also created a new kind of problem, which is that when we have a client coming in with syphilis and we're trying to do contact tracing, they often don't know the other person. They often just have a nickname. They don't know where the other person lives. So tracking down the other person and getting them in for treatment and for testing for other STIs is difficult, even more difficult than it has been in the past.
So it sounds like society's evolved in one way, and then in other ways it's made it much more difficult now.
And you know, many people have an instinctive reaction of judgment and anger at the social apps and the people who manage those social apps and own them and make money off of them, because they're making money off an app that has very bad public health outcomes and can be bad outcomes for the individuals involved. In general, I think, and the prevailing public health perspective is that these apps are here, they're not going away, people use them a lot, and a more successful approach is to work with the managers of these social apps to get them on the same page in attempts to limit transmission of sexually transmitted disease. And one way of doing that is to get them involved and pay advertising fees for STI prevention information, to be on those apps, to make people using them aware of the rise in syphilis, to take an extra degree of care, to use condoms. So the approach now is not so much anger and judgment, but to leverage what is actually there and collaborate with the people who are running those websites.
Say, if you can't beat them, join them, huh? That's what it sounds like. And to me, one of the points you made about the problem with symptoms, that they go away in a sense,
yes,
and you may not go get tested,
yes,
and then you're spreading this infection. So it sounds like we have to do a lot of education in general.
A key part of this for sexually active people, particularly people sexually active with multiple partners, whether same sex or opposite sex, is getting checked. And for many years now, a key part of HIV prevention is encouraging people to get checked. Well, the same logic applies to syphilis, and by the way, to gonorrhea and to chlamydia. That sexually active people, if they go to a health department clinic or go to an STI clinic or go to a family doctor or OBGYN, with experience in sexually transmitted diseases, can easily get checked for all of these diseases and be treated, helping their own health and helping to prevent it spreading to other people. Another big movement in HIV prevention, which is not directly related to syphilis but is somewhat relevant, is what we call PrEP, which is pre-exposure prophylaxis for people at high risk of contracting HIV, either sexually or from IV drug abuse. There is a proven evidence-based practice of using an HIV drug called Chavonda and taking it every day, and that has been shown up to 92% reduction in HIV infections with people that adhere to that. So, and inasmuch as the syphilis epidemic is going hand in hand with HIV rates, that we would hope would have some benefit also in preventing syphilis, or certainly people who enter into PrEP treatment will be tested for syphilis and be treated if it's there. Another aspect is that any sexually transmitted disease facilitates the acquisition of more sexually transmitted diseases. That HIV is much more easily transmitted if a person has inflammation in the genital tract from chlamydia, gonorrhea, syphilis. And the more we can treat and reduce the incidence of sexually transmitted diseases, the less able new exposures are to transmit them again.
Well, as always, Dr. Cockey, very informative and certainly a lot of important information on a very challenging and complex problem. And what we're going to do is have a colleague of yours, Chavonda, Carr, she's also going to speak about what we're doing at the county level in terms of education to be a little bit more proactive with our younger population.
Chavonda is a wonderful resource for the health department, as is our disease intervention specialist for the Tri-County area, Tanya Selby. They both do a wonderful job, and they're just great assets for local public health.
And thanks again for being on the program.
It's a pleasure.
So let's take a look at some resources where you can get more information on this topic, and we'll be right back. I'm back with Chavonda Carr. You are a community health educator with the Wicomico County Health Department, and you do some very important things there for our community. And I know the first thing you wanted to talk about is you are a big part of a task force that's been organized to serve Wicomico County. It's the Sexually Transmitted Infection Task Force of Wicomico County, of which Dr. Cockey is the director. But you are a very important piece. Tell me a little bit about that task force and what you aim to do with that or have done.
Well, this particular task force was in a response to the high rate of chlamydia in our particular community, especially in the ages of 15 to 24 years old. And so we addressed that particular infection as well as gonorrhea. And now we're looking at syphilis right now because the syphilis rates are rising.
So the task force was originally put together to address chlamydia and gonorrhea. And when was that? How long have you been in existence?
It's been about 3 years or so.
So you're saying more recently, because your chlamydia and gonorrhea rates have responded well, have gone down.
Yes.
Now you're focusing more on the syphilis piece of things because that is not going down.
Yes. And some of the ways that we actually address chlamydia and gonorrhea is that we had an expert to come to Salisbury University to come to talk to the young people about the particular infections, as well as we've done focus groups. We've also done lunch and learns as well with our professional staff at the health department. We've also done adolescent health resource cards through the Wicomico Board of Education. We also we revamped our website, which we're really excited about. So if you go on wicomicohealth.org, you'll be able to see our new STI webpage as well as our teen pregnancy webpage as well. And so those are some of the things that we've done.
So you're focusing on what age groups you're saying? Obviously at SU, that's the college age group.
Definitely.
And then of course you're doing programs aimed at high school and even middle school?
Yes, yes. We've had several programs through the health department. And one of the programs that we've had is a teen pregnancy prevention program. It's been in place for over 17 years. It's called the GEMS program. And that particular program is to prevent the early initiation of sexual activity in young people. And that's geared towards 6th, 7th, and 8th grade young ladies. And we want our girls to say no to sex, drugs, and alcohol. And GEMS is not an acronym. When they come into the program, they're considered unpolished stones, but through education, they become gems.
I like that.
And so this program has been an exciting program for us because we're able to educate them on self-esteem, puberty education. We're able to talk about sexually transmitted infections and just, not having sex at a young age. And also we educate them on, being the best person that they can be, being successful young ladies. We also have family homework that they do. We do overnights with them. We also, we just want to educate them on just being that best person that they can be, and so that they can become successful young adults.
So you're taking these programs into the Wicomico County-based middle schools and doing the education?
Yes, we're at 3 middle schools. It started off at Bennett Middle School, and now we're at Salisbury Middle School and Wicomico Middle School.
Oh, very good, very good. And of course you're emphasizing how to prevent STIs then, as
Yes.
well as teen pregnancy.
Yes, but this is an abstinence-only program.
Oh, okay.
And it's funded through the Department of Mental Health and Hygiene, as well as we get partnership from the Wycomico Partnership for Families and Children as well. We get funding.
And I assume you're measuring outcomes for this, and it's been successful?
Definitely, definitely. We've had about 800 to 900 girls to actually go through the program. And so we've only had maybe 2 or 3 while in the program to get pregnant. And so that's very good. So we're definitely excited about this program because the young ladies definitely respond to the program.
And what about from the parent end? Are you doing any programs there from the parent education end?
Yes, we actually have a new program. It's called Parents Matter, and we're actually working with the Wycomico Partnership for Families and Children. And it's a collaboration where we're teaching parents of young people 10 to 14 years old how to talk to them about sexuality issues. We want our parents to be the primary sexuality educators of our young people. So why not, help them out a little bit? And so we have a 5-week program that will be starting in February.
Would that be things like giving them talking points and information of how to get the conversation started?
Definitely.
That goes for a lot of issues we deal with when you're a parent.
Yeah, so it's not just sexuality.
Drugs, alcohol.
Alcohol. I mean, social media is a major issue. So we would definitely be tackling some of those issues with the parents.
Well, I know it sounds like the syphilis problem that we're seeing has to do in part with social media. And of course, at this age, perhaps, I guess it's important to get the ball rolling as far as educating our youth about what can be the dangers of social media.
Oh, definitely. And we also educate our young people on social media. We have another program that is a little bit older. We work with 10 to 19-year-olds. We work with the Department of Juvenile Services, that particular population as well, called the Personal Responsibility and Education Program. And that's also a comprehensive education program. So we talk about abstinence, but we also talk about safer sex. And so we're addressing those issues, those same issues, the career, the self-esteem, but we're also talking about, abstinence or the use of condoms and things like that, so that our young people know about both. But we also want them to live healthy lifestyles. We also want to address that social media and sexting and things like that.
Well, it sounds like this is much more of a proactive approach,
yes,
to educating at the important younger age so that they can carry these habits into adulthood.
Definitely.
Well, thanks very much, Chavonda. It sounds like a great program, and I know you say there's a website that provides information for anyone that wishes to get more information about this topic.
Oh, definitely. Wycomicohealth.org, and we have all the information there.
And can people call if they're interested in educational programs, or is this something you strictly do through the schools?
Actually, they can call me, Chavonda Carr, at 410-219-7489. I not only work with the schools, but I work with community groups, community agencies, faith-based groups as well. And I tailor my education. So if they that particular group wants abstinence education, I can do abstinence education. If they want to do comprehensive, so we definitely tailor, so we can definitely provide education, we can provide statistics. If young people or older people want statistics on this particular topic, we can help them with that as well.
Well, it sounds excellent. Thank you so much for being on the program and making us aware of all these wonderful resources we have right here in our community.
Thank you.
And thank you for joining us for this edition of Focus on Health here on PAC 14.